Recording in progress.
Good morning, everybody. Hey, Maj, I think we're probably ready to start.
Okay.
Give us a second, everybody.
Yeah. Okay. In about 5 seconds, you'll be live.
Thanks, Maj.
All right, you're good to go.
All right. Good morning, everybody. Wanted to give you an update on two things. One is where we stand with numbers of COVID in our community, and then wanted to talk a little bit about the boosters that we're starting here tomorrow locally through the health department. So let's get right to the numbers. Currently, we're averaging about 156 over the last 14 days per day of new cases that have come in, and that's still high. We were hoping to see a little bit of a downturn, lower numbers, which we did late last week, but unfortunately we kind of popped back up over the weekend. So we're going to take the next couple of days to kind of see where we're at. You might know that the state of Ohio is seeing as a whole kind of a downward trend in cases. So let's hope that continues, and that continues with Lucas County. But the problem here is, Lucas County had actually come in later into the COVID issues than the southern portion of our state. So let's see how this all pans out. But I am truly hoping that we'll start seeing a downward trend over the next couple of days and over the next weeks or so. Pediatric cases, just to kind of let you know where we were back on August 27th. We had about 277 cases reported. By 9/10, we had 658 between 8/2 and 9/10. And between 9/11 to 9/24, we had 594. So we went from 277 for the week of 8/14 to about 8/27. And then we had an upward trend, and we kind of came down a little bit over the last couple of weeks. So we might be seeing a downward trend in the pediatric cases too, but we'll have to kind of keep those in mind as we go through the next couple of days and weeks where we're at with those cases. And they do account in September for about 30% of our cases total in Lucas County. Right now, we're at about 554 per 100,000. Some good news is that means that we're 78th out of 88. So there's a number of counties that are way above us. Actually, there's one county that has about 1,800 per 100,000. So that is good news for us. Hopefully that stays that way, that we're low per that 100,000, but still we're 5 times over, really, if you would, let's just call it more of an acceptable level of that 100. And, that does cause us some concern, because we still have significant community spread inside of our county. Hospital numbers. Let's talk a tad bit about hospitals. Looking at today's numbers, we have about 206 admits throughout Lucas County of COVID. If you look a month ago on 8/28, there was about 100. Again, a little bit over double of what we saw 30 days ago. Relative to the ICU bed use, we're at 61. Again, a month ago, we're at 33. Vent use, 37. A month ago, we're at 19. So again, those numbers increased, and they are high use. Again, please remember that it's not so much the resources out there, whether it's the beds or the vents. What really is our concern is that staffing level, especially with those nurses. You don't have enough nurses to, again, take care of those vents or those beds or those patients. We have an issue. Lucas County vaccinated individuals, 224,000 plus a little bit. That equals out to about 52.21% of our population with at least that first vaccine in them. So we are continuing to progress up, which is good. Here at the department, the ones that we give out vaccine-wise, we're averaging about 487 over the last 4 weeks or so, and that's not too bad. And again, those are those first, second doses. So if we can put up a slide right now, please, I kind of want to walk through this. Boosters, that is the big topic right now. What are we looking at for boosters? Right now, only Pfizer is authorized to provide boosters to the entire community. Who should be getting them? Well, you can see on the slide here, let's walk through this real quick. So people who are 65 and older or residents of long-term care settings should receive a booster shot. People ages 50 to 64 with certain underlying medical conditions should receive that booster shot. People ages 18 to 42 with certain underlying medical conditions may receive a booster shot based on their individual benefits and risks. And then last but not least, people age 18 and older who are at increased risk for COVID-19 exposure and transmission because of their job or living in an institutional setting may receive a booster shot based on their individual benefits and risks. What does that really mean? Well, really, what we're trying to say in that last bullet point is that if you are in a job environment or an environment that you have the possibility of increased risk, those age groups 18 above, that you may want to consider getting that booster after looking at the benefit and the risk of getting that booster shot. So you could be looking at teachers, you could be looking at those that work in the grocery store, medical professionals. So there is kind of that laundry list. And I do believe CDC might be coming out with a more detailed listing of or examples of who those people might be by the end of the week. But again, that is not out yet. I don't know when that might come out, either Thursday or Friday. So what are we doing the health department wise? We are going to offer a booster shot clinic. Let me take a step back. Please remember too, we're not the only game in town anymore like we were at the start of the vaccination process. We do have the pharmacies, several doctors' offices have the vaccines. There are other places to go ahead and get the vaccine. So again, there's a larger choice of where you can go get your boosters and your first dose as well too, and your second dose than there was many months ago. But as for the health department, we are going to open up the rec center again. We just feel that that is a good spot for us right now, at least to start. We can push a large number of people through there who want to get a booster. We're going to start tomorrow, and we're going to go from 9 to 6 every Wednesday. For right now, every Thursday 9 to 4, and then Saturdays 9 to 3. What we're going to ask you to do is a couple things here for the rec center. We want to make sure that we expedite this as fast as possible. In other words, you getting there, getting through the line, and getting your vaccine, and get in, exiting the rec center as fast as we possibly can. We know we're going to have some issues here, just because this is a booster shot, the first time we're doing it, but we're going to be asking for a couple things like your vaccine card. Please locate your vaccine card and bring that with you. That's very important because again, if you don't have that vaccine card, we're going to have to search through records, and it's just going to take a lot longer to process you through the vaccination process. Also, then too, we are going to be asking you to sign up or make an appointment for the rec center for your booster. And if you go to our website, you can go to the tab where it says make an appointment and just walk through it. It's relatively easy. It's actually going to take you through some questions to make sure that you should be getting that booster as well. So that's actually a good tool for everybody to use. Please, again, bring your vaccine card and a picture ID. And I can't stress this enough. Please, we are trying to make this as easy as possible for everybody. But if you don't have the documentation, we are going to have to process you differently than everybody else, and it's going to take you longer to get through. I want to stress this too. If you have any concerns about the booster, if you think you should get the booster, any concerns or questions about the booster in general, please contact your family physician and talk with him or her to make sure, again, that you weigh out all the risks and benefits of getting the booster to make sure that, again, you're comfortable with it and that you're getting it for all the right reasons. With that all said, I'd like to open it up for questions. I didn't want to take a ton of time this morning for you, but I really wanted to bring the community up to speed about what was happening with our numbers, kind of where we're at with COVID, but then also to really the booster and the booster process. So any questions?
Melissa, you can go ahead and unmute yourself.
Yeah, hi, good morning, Eric. A lot of people are wondering if you're going to be turning people away, people that try to get their boosters for sort of a medical condition, like if they don't fit within the qualifications on a list or anything, you know, would they be in jeopardy of being turned away?
Being turned away. Let's walk through that real quick. If you've gotten Moderna and you're looking at getting a booster, we can't give you a booster of Pfizer. So again, if you've got Moderna, you're looking for a booster and you're in one of those groups we just talked about, we're not going to be able to give that to you. If you've got J&J, the same thing here. So what we're trying to do is make sure that if you've gotten Pfizer as a booster, or excuse me, if you've got Pfizer as your vaccine, you're going to get your booster as Pfizer. Eventually, I do believe Moderna is probably going to come out with a booster, and so is J&J. But again, those aren't there yet, so that's why you get turned away. If you don't have the vaccine already, in other words, you know, you're wanting a booster, but you can't prove, or you don't have your card, or for whatever reason, we can't find you in the system. We're going to have to take you aside and probably not give you the booster and talk about, you know, maybe you didn't realize you didn't get your first injection or second injection, and again, we'll start the series. Or figure out what's wrong, why you're not in the system.
Brian, go ahead and unmute yourself and ask your question.
Hi, Eric. You mentioned that you're concerned about staffing levels at hospitals. Do you have any concrete numbers as far as like what type of shortages we're seeing, and what are the hospitals telling you as far as why there's a shortage? Are people leaving, people out sick with COVID, whatever you can offer there?
Sure, Brian. And again, I don't have any hard and fast numbers for you. I just don't have those at my fingertips. I can tell you anecdotally, talking with the hospital personnel, that there's a couple things here. One, the staffing shortage, you know, the nursing staffing shortage, I think for a number of different reasons, and not just us. And we talked to the governor the other night about this as well too. It's not just us in Lucas County. It's not just the state. It's nationally. There's just this shortage. I think there's a couple things here. People, you know, our medical professionals are just getting burnt out. You know, they're working multiple shifts, long hours. They're just done. And I think some people have moved on, or they're trying to do something else in nursing. And so they're not at those hospitals. I think that's one big reason. And again, we saw kind of the nursing shortage months ago as well too. And just in general, I just think that there's shortage in the practice of nursing.
All right, Kaylee, you can ask your question.
Yeah, hi, Eric. My question is say someone who's like 30 wants to go tomorrow. It's been 6 months. They want to get their booster shot. We haven't come out with any full guidelines on what increased risk is. Say a person says they're at increased risk. How are you guys going to determine that without saying, you know, are you going to look at what their job is, or are you just going to take it at face value?
I think there's a couple answers to that question. One, if they want to talk to us about their job and, you know, kind of discuss if it's an increased risk, we'll be happy to do that. But they really are going to kind of have to just tell us, yes, I'm at increased risk because of my job, and you know we're relying on them to make sure that, you know, they're working through the risks and benefits, as well then as making sure that they do believe that they're in a risky environment. You know, meat packers, you know, we had several issues with them, or those types of organizations, you know, early on in the COVID issue. You would never kind of thought that maybe a meat packer would be in that category, but they probably are. So, you know, again, it all depends on their situation and where they work, and why they feel that they would be highly impacted if they don't get a booster.
Max, go ahead and ask your question.
Yeah, just on the same topic of turning people away. If someone were to come in, say their date of their second shot is, hasn't been 6 months yet, is that someone that you would turn away, or?
Yeah, it would be. That 6 months is there for a reason. Actually, multiple reasons. They're looking at the effectiveness or the efficacy of the vaccine at that point in time. Looking at do you really need to have it? At 5 months, you should be waiting for that sixth. Again, I think too, I don't believe that there's any negative impact, but there could be. So there's a number of things that I do believe that, again, those officials that have said to go ahead and get the boosters have looked at, and that's why it's 6 months.
Andrew, you can unmute yourself and ask your question.
Hi, Eric. I was wondering if you had any guesstimate on how many people you expect to come to the rec center to get their booster shot. And I know you said you want people to schedule appointments. Will there be any walk-in? I mean, if someone just doesn't, they're driving by the rec center and they say, hey, I'll come and get it, will they be able to go in and just walk in?
Well, especially with the start here, we're really trying to refrain from walk-ins, just because, again, we're trying to get the system back down. We're trying to get the system back in place and down to a pretty good science that we had it before, which shouldn't take us too long. So that's one reason why we're asking for people to to make an appointment. Also, then too, we're just like everybody else. We're short-staffed. We're not, since the hospitals are really having, are being inundated with COVID. We partner with them to do a lot of our first and second doses early on, and we won't probably have that capability right now, at least in a large fashion. So we're just trying to make sure that people aren't going to spend 3-4 hours standing in a line, and again, get them in and get them out as quick as we possibly can. So there's a couple things why we don't want to do walk-ups right now. But that doesn't mean that we're not going to do them maybe even next week or the week after, or open that up somehow. We're just trying to make sure that we're effective and efficient, and get people in and out as fast as we can.
Any guesstimate on how many people you're expecting?
So I asked this morning how many do we already have signed up. We have about 200 individuals signed up since we went live yesterday afternoon, and we really haven't announced it largely or widely, if you would, until this morning.
Thank you.
Sure.
Kaylee, you can ask your question.
Yeah, do we know how long of a time frame you guys are planning on having this at the rec center?
Great question. Yeah, what we want to do too is relieve some of the stress of getting this booster. So we have set up multiple weeks. I think there's 3 weeks on the books right now where you can get your appointment for boosters at the rec center. So there's not like we had early on this immediate stress and anxiety to get in and get my booster because there's only X amount of spaces open. We really want to make sure, again, over the next at least 3 weeks, individuals can go ahead and sign up, and that'll help us too. That'll help us with staffing and things of that nature, and move people through the queue there. But please remember, we don't know what's going to happen with Moderna and J&J. We also then have the possibility of children getting vaccinated towards the end of October, beginning of November. So short answer to your question, at least the next month to two. I would suggest probably if things kind of work out the way that I think they will with other boosters and or children vaccines, probably till December.
Thank you.
Sure.
Ryan, you can ask your question.
Hi, Eric. You said so 200 people are signed up. How many shots can you give in a day?
Sure. Well, we have 1,500 appointment slots for Wednesday, for Thursday and Saturday. And so we can easily give that. At the rec center, we're comfortable doing 3,000 a day if we need to, as long as, again, we can get enough of those individuals to actually look at the vaccination process, given the vaccine is our biggest hurdle. And if we really pushed there, I think we could, get more like 6,000 to 7,000 in an emergency.
It looks like that's it on questions.
Awesome. All right. Anything else, ladies and gentlemen? All right. Well, I thank you. And I'm sure we'll be talking soon.
Thanks, Eric.
Record.